Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Jeffrey Sturman. He's Senior VP and Chief Digital Information Officer at Memorial Healthcare System. Welcome, Jeff.
Thanks, John. Great to be here.
Yeah, excited for this discussion. We're honoring you. You won a couple of awards. I always love having the award-winning organizations and leaders on the podcast. But before we go there, tell us a little bit about yourself and Memorial Healthcare System.
Yeah, and thanks for saying that. It's hopefully more of an honor for Memorial Healthcare System than for any one individual. But by background, I'm what I call a recovering consultant. So I've been in and out of consulting for the last 30 years. But I've also been at Memorial Healthcare System for on and off the last 20 years.
Wow.
So a wonderful organization based here in Southeast Florida, right in Broward County. So Memorial Healthcare System is formerly the South Broward Hospital District. So we're a public entity. Our board is appointed by the governor of Florida, and we are just a wonderful community-based, rooted community-based healthcare system, really grown up to be a little bit more academic in the last number of years, a strong GME program, and just really a culture that is, I think, unique and wonderful, and community first, patient first, and always trying just to do the right thing. $3.5 billion in revenue and growing. Like I said, just an awesome organization to be a part of. And I get to be a small part of this excellent place. And not bad, but I get to live in Southeast Florida. So kind of beautiful, especially this time of year when my friends up in the Midwest and Northeast are screaming, can we come visit you? So great to be here, and look forward to the conversation.
Yeah, I'd be totally down for it, minus the hurricanes. But other than that, I think it's pretty good.
You're right. I'm a little addicted in hurricane season to the Weather Channel and seeing what's coming our way. I'm always a little bit like, hey, let's get out of here. My wife's always like, no, let's hunker down. So she
Yeah.
wins.
Well, it's an amazing place either way, and I mean, it makes sense why you've been there so long. Being part of that organization, and talk to me about what does it mean to you, and it sounds like maybe even more importantly for you, your organization, to win the CHIME and KLAS Synergy Award. And for those not familiar with the Synergy Award, it's a mix of you have to win two awards really to win the Synergy Award: the KLAS Arch Pinnacle Award, which is focused on EHR User Experience, and then the CHIME Digital Health Most Wired. You have to be 9 or above. That's focused more on digital health innovation. So you won those two awards, which makes you a winner of the Synergy. What does that mean to you and your organization?
Yeah, I think we're one of two organizations in this first year that they've actually had this new award come out, the Synergy Award, and we're so proud of it. What it really means at the end of the day for us is, we're doing the right thing for our physician community. We're doing the right thing. That if you do the right thing for your physicians and your providers, we hope that translates to doing the right thing for patient care. And like I said about Memorial and who we are, and rooted in community-based healthcare, we're very focused on our area, like probably everybody is. But we're really intentional about making the experience for our providers as best as it possibly can be. Again, then translating to what's best for our patients. And then second to that, really, that's more around the Arch Collaborative. Second to that is really the advancement of tools, the technology, how we leverage Epic and our electronic health record to be innovative and forward thinking, and taking advantage of all the latest and greatest is, an advantage. It's something that we like to stay modern with. It's something that we think helps us create a competitive advantage for our providers in our market, and again, then for our patients, because it's not just, keeping the lights on. It's all about thinking about net new, how we do things differently and better, and therefore, again, quality, safety, productivity, efficiency, all of those gains are really important in the way we use our tool set. And I think our providers, granted, you can see that from the survey results and the award here, appreciate how much effort and emphasis we put on continually evolving our electronic health record.
Yeah, I think was it Richard Branson that said if you take care of your employees, they'll take care of the customer. It's kind of if
Absolutely.
you take care of the providers, they'll take care of the patients. And burnout's a real thing. So and EHR satisfaction is a challenge. So, kudos to
It,
you and the team.
Yeah, it is. And, it's a little bit of a double-edged sword. So for so long, I feel like we as an industry and certainly at Memorial, we configured our EHR to really the nth degree. We went out of our way to meet the needs of every individual provider. We've evolved as an industry, which I'm proud about because I think standardization and consistency are important. That also then translates to better quality and better decision making. And so we've evolved our providers to think about how they leverage the tools again from that more standardized best practice scenario, and going through what Epic calls a refuel, and again taking advantage of the foundation capabilities, but then layering on it that personalization capability has been so powerful for our providers.
Interesting. What would you say what you did it take to achieve these awards? What were some of the things you did to kind of, push this forward, and why should other CIOs strive to work with their teams to earn them?
What it takes is a lot of blood, sweat, and tears, maybe, but it
It
takes a
takes
lot of
work.
work. It takes work. Yeah, everything we do takes work, and it really takes that balance of a very strong technology focus, understanding the tech capabilities, layered in and coupled with really understanding clinical workflow and physician and provider workflow, and thinking about how, again, patient care needs to influence technology and technology then needs to influence patient care. And so, this is a collaboration. We don't do this alone, and we've had this incredible balance for a long time. I'd like to say our secret sauce here at Memorial, like again, probably many other places, has been the hiring of a very balanced team, a team of really true technologists coupled with really strong clinical expertise and physician leadership and nursing leadership and just overall operational knowledge. And that balance has really created this level of success that we've achieved. And it then really keeps that level of governance and accountability and measuring ongoing. And all of those things together make this so valuable to the way in which we ultimately, again, treat patients. And so it really is this partnership that we have with our physician community, both our employed physicians, but even beyond. We have a huge non-employed physician community that we have a lot of medical staff coming in and out of our facilities, and we interact with them almost as much, if not more sometimes, than our own employees and our own physicians. We're a little bit different than most healthcare systems. Our physicians mostly are specialists by background. So we have a very strong specialist group, and that's everything from specialists on the pediatric side all the way through, very, very seasoned adult specialists. And we have a fairly small footprint, although a sizable and growing footprint on primary care. So I use the word balance a lot, and it really is that balance of, looking at specialists, looking at primary care, looking at our employed base, looking at the community-based providers, and us in IT coming together to make a difference. And that's been, again, the secret sauce of this opportunity that we've had. It's been a lot of blood, sweat, and tears over 14 years now of us being live on Epic, and we went live again in 2010 when it wasn't the product that it is today. So
Yeah.
that evolution we've seen lots of iteration, lots of evolution, and we've taken advantage of this. We're an Epic first strategy. I say it all the time. Let's take advantage of our EHR to the fullest capabilities. We all spend way too much money and energy and time and resources to not take advantage of what we have at our fingertips. So we do that very intentionally as well. And then we augment where we need to when we ever need to fill a gap. But those are few and far between.
Interesting. I love the idea of balance, but to me, it sounds like it's also about listening to the clinicians. What did you hear from the clinicians during this process and these efforts to optimize their experience and, obviously improve the organization? And what are some of the things maybe you learned from them that you were able to help them and improve the way they're using it?
Yeah, so you're 100% right. I mean, this is a listening tour that's been ongoing, and it's not just a tour of a year. It's a ongoing effort that you have to continue to be out in front of your providers. We do as much rounding, I feel like, with our providers as our providers do with their patients.
It's
And I
good, I
think I think
think.
that's good. I do think that's good. And I think it's really important that we're out in front of them. We're by their side. We're seeing what they're doing. We're learning how they can get better at what they're doing. So ongoing training, ongoing side by side education, ongoing communication is obviously the key to success with all of this. And like I said earlier, we have some very strong physician leadership, both in IT and outside of IT, in our medical staff that allows us to have this level of governance where we can share information and we can talk about what are the things that are working well and what are the things that aren't working well. And then we really put intentional action plans together to address those items. So we don't just walking in and going down a path and working in a vacuum to say, hey, Epic or any of our partner vendors are saying this is what you need to do. We're doing that in concert with what do our providers really see as valuable. And
Yeah.
then we're also looking at this from a strategy standpoint. We're not investing a lot of time and effort in those things that don't mean important things strategically at a broader perspective, a broader level for our healthcare system. So it is about listening, it is about governance, it is about communicating. And then there's a fourth element to this. And this has been, I think you can say it once, twice, 10 times, 100 times. Expectation setting is so important. Expectations, no matter how much you say it, sometimes it just doesn't penetrate. And so, you just got to keep getting out in front of your audience, your stakeholders, your community. My community happens to be, well, everybody. Everyone's my boss. So my providers, my physicians, my nurses, my operations, my leadership, but also my patients and my community that we serve. So we are doing a lot of surveying. We're doing a lot of feedback. We're looking at Google star ratings even. And we're taking all of that information and we're trying to get back out to our providers to say, here are the things that are really going to move the needle for experience and hopefully quality and safety.
Yeah. No, I love that they're listening in such an interesting way and that it's kind of servant leadership as well. Back when I was implementing EMR, one of my favorite thing to do was just sit in the nurse area, just sit in the nurse area and hearing what they're saying and being accessible to them too. It's fascinating how impactful that can be. But yeah, go ahead.
John, you're so right because my leadership team, I've told them not only do I want you rounding on the nursing floors and at the hospitals and our offsite locations, I actually want you sitting in the physician dining room. If you sit in the physician dining room at our 6 hospitals, you'll hear all the truth. So that's a really compelling and really interesting way to get information.
Yeah. My favorite is when they say, "Why can't we do this?" And then you're like, "You can."
Yeah, exactly.
And they
Exactly.
didn't even know, right? And you're like, "We
Yep.
demoed this 18 months ago." Oh, you did, but they're busy, so they forget, or maybe they didn't need it at the time. So it's interesting. It's interesting you talk about being an Epic first shop. How are you leveraging the EHR and other IT and of course now AI to kind of meet your needs? And how are you preparing for those future needs, whether it's through Epic or through other tools that you add on? Epic's obviously all in on AI, but there's probably going to be some outside AI stuff that's not going to be Epic. So how are you kind of leveraging these technologies to meet your needs and prepare for the future?
Yeah, no, it's a good question. Like I said earlier, I think we're fairly thoughtful about innovation and we're fairly thoughtful about, again, not just staying stable state, because what stable state means to us is you die on the vine. And you have to continuously look at opportunities to evolve and stay smart about where the industry is going and stay smart about where your primary vendor partners like Epic are helping take you. And so again, we're very intentional about listening even to Epic. I'll say it this way: we might drink the Kool-Aid a little bit too much sometimes, but at the same time, we spend so much time and energy and money that we really want to take best advantage of the tool set that they provide. So we are looking and we are doing and we have implemented a lot of the predictive models. So the AI models in Epic, we've taken full advantage of, sepsis and beyond. And so it is a great tool set that helps us evolve the way we take care of our patients and hopefully makes us a little bit more productive and our physicians a little bit happier in their day-to-day. If we can get our providers to be spending more time patient care, actually communicating, being in front of a patient, and we can remove some of the administrative burden by leveraging some of the AI tools and some of the robotic process automation capabilities, machine learning, and whatnot, I think that becomes a better experience for every group of stakeholders here. And so we're leveraging AI with Epic. We're leveraging AI outside of Epic as well, because you said it earlier, I said it. It can't be all things today, and maybe one day Epic will be all
They're
things.
trying to be.
They're trying to be.
There's a lot of problems in healthcare. That's the problem.
Yeah, exactly. It's you take IT and you take healthcare, and these are the two most complex industries. You bring them together, and I'm not sure how much more complex or how much more glutton for punishment people like me are asking for. But we're trying to solve things, and if I can make a little bit of a mark, if we in healthcare and IT can make a little bit of a mark to make that experience a little bit easier, I think we're doing a good job. And so. Whether it be AI in the radiology space, AI with Microsoft and what we're doing with ambient capabilities, AI with leveraging how we're really looking at virtual nursing and cutting down on patient falls and putting cameras in the rooms, and all of that being very powerful to work in concert and integration with Epic has, I think, helped us achieve maybe part of the Synergy Award, but certainly, more importantly, how we, again, stay out in front of care. And I'm really excited about how this next year plays out so that we can be not just predictive, but proactive in getting out to our community with getting out in front of disease. And not just, many of us are doing looking at secondary lung nodules and looking at things that maybe would get buried in the medical record historically that now are getting filtered and fostered up to our clinicians to take more proactive measure around. But making sure we're filling care gaps, and Epic helps us extraordinarily with this from a population health standpoint and value-based care standpoint. Making sure those care gaps are closed and that we have the right, not just technology in place, but the right people and process in place to actually impact, these really considerable clinical interventions that we need to get out in front of with regard to chronic disease conditions, with regard to, women getting their mammography on a scheduled basis, me getting my colonoscopy because I'm at that age that you're supposed to be doing this on a regular basis. And so these are really important things that we all just need to stay out in front of. And it's the tool set that helps us do that, but not by itself. Like I said, we need to make sure that we have the right processes in place and the people. And honestly, John, and we all know this and we've said it for years, that's the harder part to this equation. The technology has historically been there and has gotten us there. And we've seen great acceleration in some of these capabilities from a tech standpoint. And sometimes we operationally are trying to catch up to all of that.
Interesting. Ironically, I met a guy at Epic UGM and he said, we're building an entire startup and we're not doing any software. Because of exactly what you said, we have, hospitals have enough software. They need to solve the business problems, the workflow problems. So to your point, I think he would support that idea. Are there any other efforts that you're working on that you're looking to make an impact on? Are there things that get you excited beyond just the stuff you're doing for the award? Anything that, what are your favorite projects, I guess, outside of kind of the EHR?
I guess I'll highlight maybe two or three. The first one is we've stood up this year, and we're still in the very infancy of this. So this is going to evolve what we're calling our Care Coordination Center. It's a command center. It's like NASA, right? It's a beautiful facility with screens all over the wall, and we got our virtual nursing in the room. We got our patient flow folks in the room. We have our float pool resources who are managing this. So we're looking at productivity and efficiency as a huge opportunity in this year and the next year to come. And so we've created this command center that leverages a couple of primary tools. Epic sits in the center of all of this. So we're using the Epic command center functionality with another vendor, Artisight, for all of the virtual nursing. The AI that Artisight is providing is extraordinary. It's really, really, I mean, in the last 6 months that we've had this live, we've had no patient falls in the areas where we have these cameras.
Wow.
I mean, we all know the cost, we know the clinical impact, we know the burden that that provides on family members and patients. So that's an extraordinary capability. That's a small, it sounds like a small win. It's a huge win because it's the opportunity to then leverage this AI in concert again with Epic to really get out in front of care. So the Care Coordination Center is that plus all, like I said, the patient flow. So I have 6 hospitals, John, in a fairly tight geography, 2,300 beds across a very tight geography, serving well over 1 million and really 6 million opportunity patients in our catchment area between Palm Beach, Broward, and Dade. And so those 3 counties and what we can do to create an efficient workflow for our providers and get patients, because we're all dealing with our emergency rooms overflowing. We have not enough beds in our hospitals, but I would argue maybe we do have enough beds in our hospitals. We're just not getting the throughput in our patients in and out of our hospital as effectively as possible. And so I'm really excited about the data and how we leverage the data that comes through our command center. And we look at this from a system perspective and not 6 individual hospitals kind of doing their own thing. So we're looking at, length of stay. We're looking at patients getting out of the hospital before 2 p.m. We're looking at patients not sitting in a hallway bed in the emergency room, but maybe transitioning them to another one of our hospitals that has capacity. So the whole capacity play here is a huge, huge thing for us. The second thing that I'll talk about, which we've been on this journey now for a few years, I've talked about it a lot with others over the last few years, is what we're calling our patient access center. Everyone's dealing with access issues. I don't know if anyone's not. We can never have enough providers. We can never have enough facilities to manage our population in our community. And the Patient Access Center allows us to create a mechanism by which access is a little bit of a misnomer. It's really more about intake. But one of the primary functions of the Patient Access Center is scheduling. So we've centralized scheduling into this for the entire healthcare system, and we're migrating more and more of our physician practices into the Patient Access Center. And we're allowing now our patients to leverage technology in a new way that so many other industries have done for years now. And we're finally catching up that this multi-channel way of communicating, that we don't just expect patients to call the call center, the Patient Access Center, but we can chat with them. We can leverage a chat bot for cancel, reschedule, confirm appointments. We can text with them through Hello World, so 2-way texting that's actually meaningful as opposed to just reminding a patient about an appointment through a text, through SMS. We can actually have this kind of interaction that's much more powerful. And I've said it in many other occasions. I got a 22-year-old and a 19-year-old son. If they don't have to talk to a human being, they're really happy. I don't know that they can talk. They're both in college and they're doing extraordinarily well. But look, they want to get things done quickly, and they want to do it through automation. Whereas my wife, my mother, my father, I mean, God forbid they actually have any level of automation. They want to talk to a human. So we have to have the ways in which our population wants to communicate with us and meet their needs. And so we've really been on that patient access journey to make this easier for our patients, like I said earlier, make it easier for our providers. So leveraging decision trees in Epic so that we get the right patient, we get the right provider to the patient at the right time, at the right place is really, it sounds kind of easy, not that novel. It's really complicated. And we've been putting a lot of effort into that. And I could keep going on all the other cool innovations we've been doing, but those are two of the really biggest ones.
Yeah. And the patient access one's super interesting because it kind of bridges IT and marketing in a way that we haven't often worked in the past. Marketing was this other function, IT was keeping the lights on, and then you even have the clinical, right? So you like to do patient access right, you need technology and the understanding the workflows, you need the medical, and you need the marketing people all in concert. So kudos to you. That's a big effort.
You hit the nail on the head. We've been talking to marketing and our digital marketing team so much about this because part of the Patient Access Center mission and methodology that we're putting in place, and this year I alluded to it, is campaigns, using CRM capabilities and doing campaigns so that the Patient Access Center is not an intake function, but actually we can become a proactive mechanism by which we're communicating back out to our population that you need to do these sort of things.
Mm-hmm. Yeah,
Yeah.
it's amazing. Well, I love the work you're doing, and I love the forward thinking in a number of different aspects. So we always like to wrap up these podcast episodes with a little career discussion. What would you say is the best piece of advice that you've gotten in your career that you could share with our audience?
I've had a lot of really terrific mentors, and I'm very blessed to have a lot of people in my life, and relationships mean everything to me, just kind of who I think I am in my DNA. So I'll give you two. One's probably positive and one's maybe a little bit critical.
Okay.
But the positive one is, if we try to do everything and you try to boil the ocean, you'll probably never get anything done. So be very intentional about, what your strategy is. Like I said earlier, be focused on, what's going to move the needle this year. Be focused on those activities and put a roadmap in place for the next 2 or 3 years and try to stick to it, but also have that level of flexibility, knowing that, things come up. Who would have predicted that COVID was going to happen? Who would have predicted that AI has been taking off the way it has and really impacting healthcare at this extraordinary, exceptional way, I think. And so I think have a plan well, but have that level of flexibility and know that you can roll with the punches. That's the first thing. The second thing, maybe a little bit critical, and I don't mean to be negative at all, but surround yourself with people that are good and have the same mission that you have with regard to me as a healthcare professional of taking care of our patients. And leadership means everything, and partnerships mean everything. There are two types of learning. There's positive learning and negative learning. Positive learning we can all sustain forever, right? We all love it. Everything is great. But when you have leadership that may be negative and it's not, you're probably learning about what not to do, know that you can't sustain that and know that you need to probably make a move. And so, life's too short, work is too long, and we all need to surround ourselves, I think, with that goodness of what healthcare is all about. And so be in a sustainable environment that's going to really help you feel good about what you're doing.
Yeah. There's a power in positivity in creating that culture. And it's amazing how just one negative person can impact so many people. So I think that's some great advice, Jeff. I appreciate you sharing it. And congratulations to you and the team on the Synergy Award from CHIME and KLAS. That's a real, honor because you doubled down, right? And we're able to really do it. So kudos to you and the team. I appreciate you taking time to share your insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast applications. Thanks, Jeff.
Thank you, John. Have a great holiday.